If you're young, active, and dealing with a hip that just won't quit hurting, it can be, well, incredibly frustrating. It's a really common problem, but it can be a real puzzle to figure out. We tend to jump straight to thinking it's arthritis, but what if the real cause is something else entirely? Today, we're going to dig into those hidden causes, giving you a clear map to understand what might be going on inside your hip. So, let's just get this out of the way right now. When you hear hip pain, your brain probably goes straight to arthritis or just, getting older. But for a ton of people, especially if you're younger and on the move, that's just not the story. The world of non-arthritic hip pain is huge, and that's exactly what we're going to map out. And to make sense of it all, we're going to use what I like to call a pain map. First, we'll talk about the single most important clue for figuring this all out. Then we'll take a tour through the three main zones where this pain pops up: the front, the side, and the back. And finally, we'll wrap up by talking about the actual path to getting a diagnosis and, more importantly, getting treated. When it comes to solving the mystery of non-arthritic hip pain, doctors start with one really simple but powerful question. Where exactly does it hurt? It sounds almost too basic, right? But this is, without a doubt, the most important piece of the puzzle. It's true. By organizing all the potential causes based on where you feel that pain, is it in the front, on the side, or in the back? That's how we can narrow down the possibilities from a crazy long list to just a few likely suspects. It is the absolute essential first step to getting things right. So let's get to our first stop on the pain map, the front of the hip, what you might call your groin area. If your pain is showing up right there, one of the most common culprits the doctors look for is a condition with a bit of a long name. And that condition is femoroacetabular impingement, or FAI for short. The easiest way to think about FAI is just a poorly fitting ball and socket joint. Because the bones have a slightly abnormal shape, they end up rubbing against each other when you move. And that friction, well, it can cause pain and damage over time, and maybe even set you up for arthritis way down the road. Now, this is where it gets really interesting. This slide breaks down the two main ways this can happen. So look at those diagrams up top. On the left, you've got what's called a cam deformity. See how the ball, the femoral head, isn't perfectly round? That extra bump of bone can grind on the cartilage. Then on the right, you have a pincer deformity. This time, it's the socket that has too much coverage, and it literally pinches the tissue when you move. And now, look at the x-rays right below them. This is so cool because it shows how those diagrams translate to a real person. On the left, that angle measurement, 66 degrees, boom, that confirms a cam shape. And on the right, that 44-degree angle shows that pincer-like overcoverage from the socket. It's just a perfect visual link from the concept to the actual clinical proof. So how does this actually feel? Well, it's usually a sharp pain right in your groin that shows up with movement, maybe when you're in a deep squat or even just getting out of your car. You might also feel some clicking or catching or just a general sense of stiffness. These are all classic signs that the joint just isn't moving as smoothly as it should. Okay, let's shift gears and move to the second part of our map, the side of the hip. This is another super common spot for pain, but the causes here are totally different from what we just talked about in the front. Before we get into the condition itself, let's do a super quick anatomy tour. On the outer part of your hip, you've got a few key players. There's the gluteus medius tendon, which helps you lift your leg out to the side. There's the greater trochanteric bursa, which is just a little fluid-filled sac for cushioning. And then there's that tough band of tissue called the IT band. Pain can come from any of these guys. So this group of problems often gets bundled under the name Greater Trochanteric Pain Syndrome, or GTPS. For years, everybody just called it bursitis. But we know now that the real root of the problem is more often an issue with that gluteus medius tendon, something called tendinopathy. It's basically a repetitive stress injury that can really mess with your ability to get around. And here's the classic symptom, the one that so many people with GTPS will hear and immediately say, "Yep, that's me." It's pain on the outer hip that gets way worse at night, especially when you try to lie on that side. That direct pressure just irritates the tendon, messes with your sleep, and becomes a major source of frustration. All right, let's head to the final region of our pain map, the back of the hip, deep in the buttock area. Now, this pain can be really tricky because it often gets mistaken for other things, like sciatica, that's actually coming from your spine. This slide shows us exactly why this spot is so complicated. I mean, look how crowded it is back there. You've got the piriformis muscle, and then running right past it, or sometimes even through it, is the massive sciatic nerve. You can see right away how easily that nerve could get irritated or squeezed by everything around it. And that leads us to something called deep gluteal syndrome, or DGS. The key phrase to remember here is non-discogenic. All that means is that the sciatic nerve pain isn't coming from a disc problem in your back. Instead, the nerve is getting pinched in that crowded gluteal space by a muscle or some other tissue. And this quote from the source material just hits the nail on the head. It perfectly sums up the challenge. Because the symptoms of DGS can feel so much like sciatica, or even pain coming from inside the hip joint, it takes a really careful evaluation to find the true source of the problem. So we've mapped out the pain. What's next? Well, understanding the typical road to diagnosis and treatment is just as important as knowing the causes. It really empowers you to be a part of the process. Now, for most of these conditions, the good news is that we don't start with the most drastic option. The first step is almost always conservative care. Things like physical therapy and changing up your activities. If that doesn't quite do the trick, injections can be used both to help figure out the problem and to give you some relief. Surgery, like a hip arthroscopy, is usually only considered after those other options have been tried. So what are the big takeaways here? First, remember that hip pain, especially in active people, is not always arthritis. Second, where it hurts, that is your biggest clue. A systematic evaluation by a professional is absolutely crucial. The whole point of this explainer is to give you a framework, a better way to understand your own body so you can have a much more informed conversation with your doctor. You know, we've made these incredible leaps in diagnosing and treating these complex hip problems. But as our knowledge of biomechanics keeps growing, it brings up a really fascinating question for the future. Could we one day move beyond just treating this stuff and actually start to prevent this kind of pain from ever developing in the first place?